This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, and we're going to be heading up to the rheumatology department. We're going to sit down with Cindy Molson, who's a nurse practitioner in Dr. Zhu's office, and we're going to find out everything you need to know about gout. Well, Cindy, thanks for taking some time with us once again. Today we're talking about gout, and I guess when I think about gout, and I don't know much about it, is I hear people eating seafood and then having some kind of reaction to it. So is gout a seafood problem?
Gout is a problem with some of the things we eat,
Okay.
as well as some of the things we drink. It's actually, gout is a buildup of uric acid in our bloodstream, and uric acid is a normal waste in our body, and our body can either retain that or we just ingest too much of that, and we retain it in different ways. But what happens is we build it up in our body, and either our body is not handling that amount of waste or our kidneys are not allowing us to dispose of it.
So what are some of those symptoms then that a person with gout would experience?
With acute gout, they come in with a swollen red, very painful joint. People cannot sometimes even tolerate a sheet on their joint. It's usually in the big toe, but it can affect any part of any joint in the body.
You talked about some of the foods that you might be able to ingest that would inflame gout, but what causes it? Is it genetic?
There can be a genetic tendency. If your father or brother has it, sometimes you have a tendency to get it. Somebody who's prone to it will find that the red meat that they eat, the alcohol that they drink, the beer, the seafood that they eat.
How do you diagnose that it's actually gout?
So there's a couple of things that we do. We check uric acid, but during acute flare-up of gout, uric acid can be normal. It doesn't have to be elevated during that time. We do a blood test on uric acid, so when we see somebody with an acute attack, we don't check uric acid right away. What we do is we actually pull fluid out of that painful swollen joint, and we look under the microscope to see crystals. There's actually uric acid crystals we can see on the microscope, and that will tell us that it's definitely gout. There's things that can mimic that red swollen joint, rheumatoid arthritis, inflammatory arthritis, things like that. So unless we see those crystals, we're not 100% sure.
Okay. I would imagine in treating gout, you're going to take away all the things we like to eat and drink, but how is it treated?
So there are different kinds of meds. For an acute gout attack, we use colchicine. That will help take that acute attack away. And then there's anti-inflammatories such as indomethacin, and that can help lessen that pain, swelling pretty fast too. For chronic gout, somebody who's got a high uric acid, we want to bring that uric acid down. We use things like allopurinol or Uloric. You see that advertised on TV a lot. And so those things can be used. So if somebody whose kidneys aren't really getting rid of that, there's something called probenecid. We can use that. So,
are there things that we can do from a lifestyle perspective that might help reduce the gout symptoms?
Decreasing the intake of red meats, seafood, alcohol, beer. Believe it or not, cherry products. Eating cherries, drinking unsweetened cherry juice. Sounds delicious. The other thing that can make it worse is sugary drinks, sodas. That can make it worse too, cutting down on that. Another thing is drinking low-fat milk can help. That can help gout.
Yeah. And if somebody feels like they have some questions, again, check with your primary care or
Yes.
here at the rheumatology department?
Yep, if they don't need a referral, they can come on in and we can see them. If they need a referral, just check with their primary care provider.
Okay, well we appreciate you taking time again with us to talk about gout.
Sure.
If you have any questions about gout, you can always contact your primary care provider or give us a call here at the Rheumatology Department at Aurora Medical Center in Oshkosh at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.